your life work.
If you want to be a professional nurse, it is necessary to choose a good school of nursing, because only in a good nursing school can you get the preparation on which your future as a nurse must depend. You first should be a high school graduate, and although the requirements of individual nursing schools vary, in general, it is well to take the college preparatory program offered by the high school. In nursing, as in every other field, the more educational and cultural background you bring to your work, the farther you probably will go. In planning your career, write to the State Board of Nurse Examiners in the state in which you wish to obtain your nursing education for a list of schools of nursing which meet requirements set by law in that state. A growing number of schools of nursing are connected with universities. The largest number are owned and operated by hospitals. Their course of instruction usually covers a period of 3 years and leads to the nursing diploma. Visit the nursing school which you are considering, or at least write for a catalog. Get definite information about the size, preparation, and experience of the school faculty. Find out if the diploma of the nursing school entitles you to take state board examinations. Inquire if the school is approved by the medical profession, and investigate the courses provided for student nurses. Good schools of nursing will admit only those high school graduates who placed in the upper third or half of their class, and give preference to young people who have had work or experience beyond high school. The good nursing school first will be concerned for your own health. You'll be given a thorough medical examination and must meet certain health standards before you are accepted. You will learn to practice rules of positive health, and there should be recreational facilities available for your use and that of your fellow students. Your own personality is very important to the success of your nursing career. The ability to get along with other people is valuable in any profession, but it is absolutely essential to the nurse. You should be strong, because as a nurse, people will depend on you. You should be trustworthy, because people will confide in you. You should be steady, dependable, self-reliant, tactful, sympathetic, and have a sense of humor. You should have a spirit of service and a sincere interest in human beings of all classes and kinds. Your nursing school courses in psychology and sociology will help you in your work with patients and your relationships with other people. And reading nursing literature and other books in the school library will also help. In all good schools of nursing, courses in biology, bacteriology, and chemistry are provided, and it will be very helpful for you to have some background in the science subjects before you enter nursing school. Work in anatomy and physiology must be included, for a knowledge of the human body and its functions is essential in the work of the nurse. Instruction in nutrition and cookery are necessary to teach the nurse how properly to direct the preparation of food for patients, and in many cases, to prepare it herself. When she is caring for patients in the home and lacks the scientific facilities of the modern hospital, this ability and a great amount of resourcefulness is especially valuable. Well-equipped schools of nursing provide a nursing arts laboratory or a demonstration room, which is set up like a small ward with beds and a medicine cupboard and other supplies. Here, nursing procedures may be demonstrated, and the student nurses practice the techniques of nursing using one another as practice patients. The care of communicable diseases requires special techniques which the nurse must master for her own welfare as well as for that of the patients. Such techniques are based upon absolute cleanliness and the use of disinfectants. The majority of nursing schools have an arrangement whereby the student nurse receives her room and board, and in some cases other items such as laundry, in return for service given in care of patients under the direction of supervisors. The better schools give valuable instruction during the hours of practice on the wards, including conferences, bedside clinics, and individual assistance from the instructors. During the clinical period, the student nurse should gain experience in medical, surgical, maternity, and communicable disease nursing, the care of children and the mentally ill, and the knowledge of public health nursing. The joy of any girl is justified when she receives the diploma of her nursing school and knows that she is about to begin a constructive career in the profession she has chosen. After completing their preparation in a school of nursing, graduate nurses must pass state board examinations before they can get employment as registered nurses with the privilege of using the initials RN after their names. Private duty nurses may be called by a doctor or by some member of the family to give special nursing care to someone who is sick either in the hospital or in the home. Whenever called, the private duty nurse goes, ready to fit in wherever the patient may be, regardless of what the illness is. She usually cares for only one patient and helps that patient through all the stages of the illness. Each patient presents a different personality, different problems, and the nurse must bring comfort and assurance to the patient and the patient's family. And it is also important that she teach them to guard against future illness. The private duty nurse gains wide experience in different kinds of illness and has a chance to make many friends. Nurses in factories give first aid treatment in case of accidents and supervise the health of workers. To a great extent, heavy industry employs male nurses who are increasing in number, and other men in nursing are employed in the care of the mentally ill and in prison hospitals. In schools, the school nurse gives physical examinations to the pupils and works with the teachers in educating the pupils in good health habits and in preventing the spread of diseases in the school. In some fields of public health nursing, the nurse visits her patients in their homes. Under the physician's direction, she gives care to the sick and combats epidemics. She teaches mothers how to give their families better food and health care. It is due largely to her that many children are given the right start in life and that fathers and mothers are learning the rules of health that lead to happier and more useful living. In great emergencies, an army of enrolled Red Cross nurses can be called together very quickly to give emergency nursing service. The federal government employs thousands of nurses in the Army Nurse Corps, the Navy Nurse Corps, the United States Public Health Service, the United States Indian Service, and in Veterans Administration hospitals. You can see for yourself that there's a definite demand for well-qualified nurses in public health nursing and in government service. For any kind of serious illness, doctors ordinarily recommend that patients be placed in a hospital if possible because of the better facilities and care that is available there. Staff nurses guard and care for the sick on the wards, both day and night, and also give care to people who periodically come to the outpatient department for treatment. The nurses take temperature and pulse, give medicine and special treatments as prescribed by the doctor, and do everything possible for the comfort and speedy recovery of the patient. To the doctor, they report the patient's condition and have ready for him the solutions and dressings which he may need. Nurses in the operating rooms prepare the operating table, sterilize the instruments, and lay them out in proper position and order. After the patient has been made ready for the operation, the nurse assists the surgeon by handing him the right instruments and materials as required. Nurses on duty in the emergency ward must be prepared at all times to assist in the care of any cases brought in by the ambulances. In institutional nursing, there are a number of administrative positions, including those of hospital superintendent, director of nursing service, head nurse, and supervisor. Many nurses hold positions on the faculties of schools of nursing. Such positions as these are definitely worth planning toward. Preparation for them requires at least some college background, and in many instances, a degree and postgraduate work, in addition to executive or teaching ability. The nurses who deal with the treatment and care of children must be able to apply treatments as specified by the doctor and have a knowledge of proper foods and their preparation, for in many diseases, permanent cure may result only from correction of the diet and be a slow process. Child nursing requires a liking for children and the ability to work happily with them. The nurses in the maternity wards care for mothers and their babies. The chief aim of maternity nursing is a well baby and a well mother who knows how to care for herself and her baby. Part of the responsibility of the nurse, therefore, is to teach mothers the correct care of their babies when very tiny and as they grow older. If you really want to be a nurse, do your best work at all times, both in your preparation and in actual service. In this way, will you gain the knowledge, vision, and understanding necessary to make your life as a nurse a successful and happy one.
Good morning, visiting nurse service. I'll be glad to help you. I'll check which nurse handles the case.
All right, I'll check on that for you and let you know. You're welcome. Goodbye now. Good morning. How are you?
Fine.
Mrs. Klein called. She was wondering if you were planning a visit today.
Yes, I am. I will be seeing her sometime this afternoon, but I will give her a call before I leave the office.
Oh, that's good. How is she doing with her new walker?
Well, let's say we're getting there slowly but surely. She is anxious, and this is what's important.
The clinic also called on Judy Mallon. She still hasn't kept any of her clinic appointments.
Her name is Gloria Roberts. She's a visiting nurse. In the next few hours, she will visit and help a variety of people with different needs. It isn't always easy, but she doesn't mind. She knows her job, and she likes people.
Now, Miss Klein, position yourself to the edge of the bed. Slowly now. Place your hands here on each side of the walkerette. Now, raise yourself up slowly.
Could you help me, please?
Certainly. Slowly now. Balance yourself. Fine. We're going to place no weight on the bad leg. Now slowly walk forward. Do you have any pain?
No.
Fine.
Can I do this with her?
Certainly, Mr. Klein.
How often?
Take her up and down the hallway 3 times a day.
I see.
Would you like to try some more?
Yes,
Fine.
please.
Slowly now. Very good.
How is it?
A little higher than what it was last week, Mr. Grimaldi. Have you been taking your medicines?
Yeah.
Have you been following your diet?
Well, I went to the clinic and they told me what I should eat, but when I came back, I forgot.
Well, we'll discuss that a little bit later, but would you like me to call the hospital for a diet slip?
Yeah, I appreciate that.
Hello, Mrs. Smith? This is Mrs. Roberts, the visiting nurse. I'm calling in regards to Mr. Grimaldi. Yes, he's in need of a diet slip. Could one be sent out to him immediately? Thank you very much. The baby has grown since the last time I saw her.
Oh, yes, she certainly has. She's eating like a horse.
How is the foot?
Well, I don't think you've seen it since the doctor took the cast off. Would you like to take a look at it?
Certainly.
Okay. Okay. There we go. Mm-hmm. How does it look?
Well, the range of motion seems very good.
Should I continue with the exercises?
I spoke to the doctor, and he wishes you to continue on with the exercises as he planned with you.
Good, I'll do that.
Your temperature is normal, Mr. Wilson. How do you feel?
Fine, but when can I get out of bed?
Well, I spoke to your doctor. He said your lungs are clearing, but you still require a few more weeks in bed.
Yes, but I need to go back to work.
Do you receive compensation?
Yes, still, but I like to go back to work. It's boring in the bed all the time.
How was his diet, Mrs. Wilson?
Pretty good.
Well, Mr. Wilson, you were very sick at one time. Now you're on the way to recovery.
Yes, but I'm used to working.
It's just going to take some patience, Mr. Wilson. Judy, Mrs. Laurie called, and she was quite concerned that you didn't keep your clinic appointment. You know, in your early months of pregnancy, you have to have close supervision. Were there any problems? Will you tell me what the problem is, Judy?
Does my mother have to come with me?
I'm afraid she does. But, Miss Laurie, she will be there with you. Would you like me to make an appointment for you?
Yes.
Don't worry. We'll all help you as much as we can. Hello? This is Gloria Roberts, visiting nurse. Yes, Mrs. Trudy, how are you? Yes, I'm calling in regards to Judy Malin. Yes, we have been able to break through. She will be keeping her appointment. Thank you. Goodbye.
Nurses are special people. Gloria Roberts was graduated from high school in Miami, Florida. She came to New York and enrolled in the Lincoln School of Nursing. 3 years later, she was graduated as a registered nurse, and shortly after, she joined the Visiting Nurse Service of New York. Her days are long. Her feet often hurt. She has to know her job. She can't afford to make mistakes. She can't always solve her patients' problems. But she loves her work. Nurses are special people.
Good morning, Mr. Spiegel. I'm going to put a thermometer in your mouth. Did you have a good night? I'm leaving now, Mr. Spiegel. Can I get you anything?
Miss Nelson, I wonder if I could see you for a couple of minutes.
All right.
Fine.
I suppose you want to talk with me about Mr. Spiegel, Dr. James.
Yes, Miss Nelson. He's pretty hard to get along with, isn't he?
Yes, he is. And you know, his family's been complaining. Last time they said I don't talk to him enough. I think that somebody should tell his family that he's not the only patient on this division.
I suppose you're also short-handed as usual?
Yes. And you know, it's very frustrating, Dr. James, when you try to talk to somebody who can't talk back to you. I've been nursing for 15 years, Dr. James, and I've never had anybody complain about me.
Well, Miss Nelson, we all know that stroke patients are tough to take care of. What I'd like you to do, though, is to treat him as if he understands what you're saying. Now, I know this will take a lot of patience on your part, but the nurse is a key person on the staff to get through to him at this stage.
Dr. James, I'd like to know how one nurse who has to do the job of two nurses is going to find the time and the patience to do
Now,
what
Miss
you want. You know,
Nelson,
I've been working a double shift, Dr.
now, just
James.
calm down, Miss Nelson. We know this
When Miss
hasn't been a
Watkins
typical
goes
day.
and calls and tells me her baby's sick and I have to go and take
This is not
over.
a typical day, and we both know it. But I'd like you to try my suggestions, and I'll be talking to you in a few days about Mr. Spiegel again.
All right, I'll try.
Fine.
Morning, Marge. Hi, how'd you sleep last night? Well, look here, Marge. April 1st.
Inasmuch as you're relatively new on the neurology service, I think it'd be a good idea for you to see as many different kinds of patients as you can. And this patient is relatively new here. She's been here only a few days, actually.
What would her tentative diagnosis be, and how would you be able to tell since she can't speak?
Well, actually, it's a little bit too early to tell how much she's going to be able to understand or to speak. All we can say now is that this is a global aphasia.
What happened to me? Why don't answer? I can't talk!
Miss Nelson? Miss Nelson? Miss Nelson?
That's my name. Marge Nelson. Marge Nelson.
Miss Nelson?
You're not ready for that yet. You've only been here a week. I want you to look at me, listen, and do what I say. Raise your hand. Your hand, Miss Nelson. Raise your hand. No, Miss Nelson. Raise your hand.
Margaret, you must always raise your hand when you want to leave the room. Do you understand? Look at me when I'm talking to you. Raise your hand. Raise your hand.
Good. Good. Now, point to the girl. Point to the girl. To the girl, Miss Nelson. Good. Now, point to the dog. To the dog, Miss Nelson. Point to the dog. Miss Nelson, point to the dog. It's possible she may have right homonymous hemianopsia, which, as you should know, means she can't see out of the right side of each eye, and that may be why she's missing the dog. Quite possible she have right homonymous hemianopsia, you should know, means she can't see out of the right side of the eye. Maybe that's why she's missing the dog.
Don't talk about me as if I was dead.
My dear dead. Da 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 da. Da 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 da. My dear dead, my dear dead,
All right, Miss Nelson. Miss Nelson. Miss Nelson, that won't help you one bit. That will not help you make progress. Now, just listen, look at me, and do what I say. Miss Nelson, raise your left foot. Raise your left foot. Miss Nelson, raise your foot.
raise your paw. Chef, raise your paw. Raise your paw. Your paw. Your paw.
All right, Mr. Burton. That's enough for today. I think you're tired. We'll try again Thursday.
Oh, hi, Judy. How are you? Fine. How are you? Oh, fine. How have you been? Well, all right. I'm good.
We're all useless.
Oh, I can imagine.
You too.
It's your turn, Mr. Campen. It's your turn.
Why do they shout? Don't they know we can hear? How can they know how we feel?
These students are interested in finding out how you feel inside, Mr. Campen.
Got a tough job.
Well, I guess they do, don't they, Mr. Campen? Let's get to work now. Do you remember the last time you were here, we talked about your dysarthria, which is the weakness in your face muscles. And that's why you have trouble saying sounds and words, and why you need your handkerchief so often, isn't it? And then we also worked on real small words that you have...
Small. Talk. all time. No, women talk all time. No.
Oh, did women talk a lot at home this weekend?
Home, boy. Fight, boy. Home, mama. Mama.
Dad's talking like a baby.
Yeah. Brain, no good. Ear, mouth, fight, boy, all fouled up.
Mom, I think Dad's nuts. Don't you ever say that!
Janet, I love you. You.
Dad home, no. Why?
Mr. Camplin, I think maybe we should talk with Dr. James.
Mr. Camplin, I know you feel discouraged, but there are a number of ways that you are showing progress. I hear you're starting to write with your left hand. Also, your test results here show that...
You be doctor?
No, not exactly, but they show you still have excellent mechanical skills.
No.
I know you can't use your right hand, but you still have excellent skills with your other hand, and your understanding is good.
Stand?
No, I didn't mean stand up, Mr. Camplin. I mean understand.
Sit?
You...
What? Sit? Stand? Sala de emergencia.
I'm sorry, I don't know that word. Can you give it to me in...
Salon de emergencia.
Salon.
Mean. Words mean.
What they mean, right.
Words mean.
That's right. So you are showing progress that way also. And you do understand more. The social worker told me that your wife didn't make her usual call today. Did something happen between you and your wife?
Yeah. No. No.
I'll help you.
Close off myself. Janet. Hi, Jim. No. Hi, Jim. Hi, Jim. No.
Oh, Mr. Camplin, I know it's hard to be patient.
Hi, Janet.
Good.
Hi, Janet.
Good.
Hi, Janet.
Good. Very good.
Janet, I love you.
Listen, don't you feel well?
Yeah.
Go to sleep now.
Yeah. No more man, nothing.
You feel like you're nothing, but those are feelings that can change. It's something that you and I can work on.
Try, but...
It's hard for a woman to understand what you're going through.
Oh, look at your flowers, Marge. Aren't they beautiful? Aren't they beautiful, Marge? Do you remember the flowers we got at graduation, Marge? You know, you've got a nice room here. Don't you think she's lucky? Marge, you remember me, don't you? Josephine. Josephine.
You're fat. Your name is Joseph Fat.
Oh, Marge, you remember old Hatchet Face at Nursing Art? Oh, she was just hysterical. She used to say, a child can take a temperature. It all depends on how you hold your elbow. Damn you! Go! 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 Well, she can certainly talk. But that's automatic speech. You know, when they don't have to think, they can all swear.
Maybe we'd be better if you weren't all in the room at the same time.
Yes, maybe.
Yes. Josephine can be so irritating. Marge, you do understand so much. Things will be coming back to you now more and more. Marge, have you tried to read? Look, Marge, can you read this, Marge? You can only see half of it. Is that it, Marge?
Yes. Yes.
But try moving your head until you can see the whole word. That's it. Can you read it now, Marge? Yeah, that's it. That was good, Marge. How about writing? Do you think you could write? Try writing the word look. E. Marge, are you trying to write the word I?
No! Look! Look!
I, Marge. E-Y-E. You left out the Y.
Why did it happen to me?
What? Yes, that's it, Marge. Why?
What? What?
That's right, Marge. Why?
What? What? But somebody can use a nurse that's been through it. First, I gotta talk.
Look, Marge, can you read this, Marge?
Hello, Miss Nelson. Peggy McRae tells me that you've given up since you fell last week. I can understand why you might be discouraged. You probably thought that there were some easy things that you could do, and then you found out you couldn't do them. The important thing, though, now is you are improving, Miss Nelson. You can understand more. You're beginning to write. You're beginning to read. You have more movement in your arm and leg. These are all good signs.
A nitwit with half a brain. No brain. Only
Oh.
Miss Nelson. Miss Nelson, there's someone here I'd like you to meet. He needs your help, and I think you can get something out of it, too. Would it be all right with you? Fine. Come on in.
Jack Cam Hub. Cam Pin. Chief. No. Chief. No. Three. Number. Chief. No. Three.
See, that's what we've been talking about.
What's the matter, honey?
Jack, it was awful. It was awful. I messed up the switchboard and they wouldn't even let me explain.
Well, to hell with them if they won't let you explain. Forget them. They're not worth it.
He just needs you to talk with.
Where? Here.
Mrs. Campen, you can show them how much you understand when they're finished in here.
Love you.
I help you.
Pain has no respect for fame or fortune, nor for sex, nor age. Pain and its alleviation. This is alleviation of pain on an intuitive level. The patient's normal reactions and characteristics are well known. The degree of pain may be calculated. Here, the extent of tissue damage bears a close relationship to the intensity of the pain signal. Early in life, man learns that this mysterious signal is to warn him of something wrong, and willfully or instinctively, he attempts to avoid or relieve the pain. On a professional level, alleviation of pain is highly complex. Here, decisions may be instinctive. But usually, alleviation is based upon due consideration of all possible contributing factors. When the nature of pain and its probable duration are unknown to the patient, such elements of mystery make the sensation doubly ominous and magnify the problems of alleviation. The very presence of the nurse often gives great comfort and support to the patient. To the nurse, pain is no great mystery. To alleviate pain on a professional level involves study, practice, research. Pain. What is it? If on a normally sensitive area such as the skin an injury is sustained, impulses are generated and transmitted through the peripheral and central nervous systems and register in the cerebral cortex as the sensation of pain. Nothing is flowing back along the nerves over which impulses have traveled. This reference of a sensation back is purely a mental process called projection. Pain at the site of injury is projection of sensation.
And after medication, the patient, having been freed from pain, was able to cooperate more fully, and early recovery now appears to...
Jimmy, don't cry. Jimmy, don't be okay. He'll be okay. Oh, God, where's the doctor? I don't know. Let's find him quick. The burn is terrible. Oh, where's the doctor? I'll be back. I'm hanging there in just a moment. Let me take a good look. I've been touched.
Emergency, maybe second degree. Pain intense. I can't stop it. Must act fast. No time to talk. Wish I could calm the mother. She's tense.
You better clean off as much grease as you can.
Get the grease off fast so as not to prolong the pain. The quicker I can do it, the less pain Jimmy will have. Must let him know I'm on and tell him what's coming up.
Pain is an angry thing. It can explode into 1,000 burning fragments. Alleviation can mean the subduing of these many sparks in order to relieve the hot, heavy weight of pain at its source. For pain can weigh 300 tons. Why does it hurt? How long will it last? Can they do anything? What will they do? Was it my fault? Will I die? Pain is a mysterious monster that looms large in the darkness of the unknowing. The healing light of reason can cause the monster to retreat, its sharp claws being dulled. Alleviation can be like driving 17 horses at once. Each unbridled force must be controlled, guided, and urged forward. In a case of accidental injury, there is always the question of guilt. Who was at fault? Who had a part in making possible this pain? Each must be reassured. An accident is a thing of chance. It may, as here, also be a contingency. Accidents contingent upon conditions that are unforeseeable can well be fortuitous, wherein no injury takes place. It is all a matter of chance. If all who are involved can be led to believe that the accident just happened, then each is more able to support the other, rather than generating further problems because of their own concerns. This is especially true within the family group. They must live with each other. An accidental injury to any one is a family problem.
And we had a long talk afterward. Physically, a clean but painful injury. Should heal well. No problems on the cultural level. Emotional reactions about normal, considering the number involved.
Sudden, unexpected pain can strike with electric shock. Dietary or systemic weakness can cause a gallstone to form or lodge in the cystic duct, blocking the flow of bile. Involuntary muscular contractions seek to dislodge the obstruction. During spasms in the duct, distension is severe, pain is deep. Antispasmodics are often a first step.
What were all those other medicines they gave me?
Well, one was to relax the duct, which would let the bile through, to prevent the pain of the spasm. Did you have much pain? I hope you're more comfortable now.
The medicine with your explanation about gallstones. Am I going to have surgery?
We don't know yet. Dr. Fitzrays. Sometimes stones pass right on through.
Oh, you'll never know what I've been through.
Oh, it must have been awful.
Oh, it was awful. It was just like a sharp, jagged knife cutting through me, jabbing right through me.
That could be most frightening. Where was the pain?
Well, I've never been sick a day in my life. Oh, a little indigestion now and then, but this? Oh, where? It was right here, below my ribs. Well, actually, it was my whole side. And then I got older. Well, if it's gallstones, why should my shoulder hurt?
That's called referred pain. You see, your nervous system receives a signal that something's wrong.
Alleviation can consist of attention, support, distraction, explanation, comfort, peace of mind, a logical acceptance of reality, all enemies of pain. Pain thrives on mystery and anxiety. Alleviation can also be the evaluation of the many things that may be causing pain or discomfort, and the selection of those measures of care that are most needed. This is made easier by knowledge acquired in a previous relationship.
The incision is painful. So is the abdominal distension. Would moving her be enough? Or should it be a Harris flush? Throat may be sore from the tube. Should look into that. She's getting a lot of glare from the window. The IV is probably highly uncomfortable. Hand is really rigid. She's been on her back a long time. Circulation problems. Needs repositioning. Maybe a back rub. I'm going to do something to make you more comfortable.
Oh, nurse, I feel so miserable. I hurt all over, every inch of me. You've got to do something to help me, or I'd sooner you'd leave me alone, and I'll just die.
I'm going to get some medicine to relieve the pain. I'll be right back.
Pain cannot be measured like other quantities or volumes. It can only be reported. In some cultures, reporting is conditioned or completely absent.
Are you in pain?
I ain't jumping like I could be, sister.
I know it hurts. Where?
The nurse is trained to recognize these differences in response, to evaluate the approximate degree of pain being experienced, and to act accordingly. A differential may be established between the person who is naturally stolid and one who through cultural experience has acquired the philosophy of the Stoic.
Looks uncomfortable. They say he had a pretty good day. Maybe he has nighttime blues or is just lonely. He never complains, but his illness often causes pain. Are you having pain?
Yes. I have pain.
Where? What is it like?
There. It's nothing, really. I'll be all right.
Observation can usually reveal the existence of pain signals in those inclined toward the non-verbal. An approach to the assessment of pain and prediction of effective measures of alleviation may well differ from the approach used with those who are somewhat verbose or demonstrative.
I just can't stand it. Nurse, forgive me for troubling you, but I just can't stand it. Hand me another kerchief, please. No, the organ one. Oh, I feel so horrible.
When did it start?
I felt much better before my operation. Isn't that light awfully bright?
Where does it hurt?
Really? No one should be expected to suffer this way. What have I done to deserve such pain? Call my doctor, miss.
You're probably having gas pains. Distension is not uncommon for patients that have had this type of operation. Yes, you do seem to have distension, mostly on the right. I believe you'll be more comfortable if you turn to your side.
Oh, no, nurse. That'll put all the weight just where it hurts the most.
Gas accumulates in the large intestine, stretching it beyond normal and causing pain. Now, if you move, the gas moves, relieving the pressure and the pain. There. Now the gas can go up the transverse colon and out. Now, how's that?
Why, I feel better already.
That's fine. Now, I'll be back soon to see how you're getting along.
Honey, come back soon. And often.
Doctor, you're killing me.
Here, hold this. Only a few more stitches.
Early cultural experience can often overweigh later intellectual and physical development in relation to response to pain. Physical characteristics may be highly deceptive as to possible patient response. They may be in parallel, or divergent, or mixed. Any clue to cultural conditioning could be of great help in such an evaluation.
Hurt? Sure does.
IND abscess. You seem to place a high value on self-restraint. A few moments now. What else can I squeeze in? Mr. Purcell. Oh, probably best tell him it'll soon be time to get up. He doesn't like to be taken unawares.
Oh, dear. Oh. Hi, girlie.
How's the arthritis this morning, Mr. Purcell?
See, I got my knees down.
Yes, I see.
Now, what do you have to keep rubbing my knees for? They're sore, you know.
We must keep them flexible, limber, so you can get around and see things.
See things? Oh, I've seen everything already. Have you hand me my tobacco, will you? Thank you.
See things and people, your old haunts, friends, places.
Yeah. Well, let them come and see me.
Oh, come now. You want to be your own boss, don't you? Do what you want, when you want? Actually, it'll soon be time for you to get up.
Girlie, you sound just like my old lady.
And I'm going to see what I can do about some visitors for him. But Mr. Purcell is better. He has no severe pressure areas, no contractures. I plan to get him up this afternoon. Of course, he still has appreciable pain.
Respiration okay?
Yes, although he does object to being turned strenuously.
Wonderful fellow.
You know, he really is.
Pain, when its causes or its consequences involve mystery, often results in some degree of anxiety. The element of mystery can expand to the point wherein the patient feels that he should indeed close his eyes and lips, feels that his initiation into the mysterious is being carried too far. He may doubt his own ability to cope with the situation. His instincts are to flee or fight. Even minimal anxiety is an emotional state that affects the heart rate, respiration, vasomotor reactions, muscle tone.
Oh, nurse, I'm so glad you came.
I brought you some milk. You had so little dinner.
Thank you. Oh, nurse, I'm so worried.
What's the matter?
Oh, my stomach feels so heavy, and now the pain's deep and boring, too.
Boring pain?
Yes. I've had it several times during the past few weeks. Do you suppose I have cancer?
We don't know. You are worried about it, aren't you?
Well, my husband says that with female troubles, anything can happen. Sometimes I wonder if Harry's afraid that I won't be able to be a good wife to him any longer. Oh, if only I knew. He's such a good guy. So are the kids.
Here, anxiety is normal in proportion to the threat as perceived. Mystery, the element of the unknown, has affected the degree of symptom response. Should the mysterious threat be greater, anxiety can achieve a level wherein behavior may become peculiar, even antisocial.
Let me help you.
I'm okay. Don't touch me. Where's the doc?
Please be seated in the treatment chair. The doctor will be right in. He can't see from his left eye. Instrument maker. Precision work. He's really worried. Must be afraid of loss of vision. So, unable to work and support family. Sure is mad at everybody, including me, and probably himself. Needs help badly, but we'll fight it. Well, here we go. Let's clean that up and see what you have there.
That hurts, damn it! Will you just get the doctor?
Here, hold this. So we'll just clean the blood away. Yes, your eye looks all right.
My eye, all right? Is it bad?
A few stitches will pull it together nicely.
Take it easy, will you?
Nurse, give me some more 4x4s.
Nurse, how much longer?
Looks like the doctor's nearly finished.
Once the threat to the body image is dispelled, anxiety usually diminishes or disappears completely. Threat, anxiety, pain. Often these feed on each other. Over prolonged periods of time, the patient may acquire an undue fascination with each facet of his condition. He is inclined to embrace the mystery. He begins to lose touch with reality.
Get me some milk.
I cannot do that, sir.
Get it, I tell you. Nurse, I must have some milk. My stomach is on fire, and these horrible pains. It's gotten so that I can't eat, or you won't let me.
Now, you must have your stomach empty for your x-rays. You'll be getting some barium to swallow soon.
Nobody seems to know when I'm to go in. Why don't they have a schedule around here?
I'll call and see what time they have you down to go. Maybe we can move up your schedule.
Well, thank you. Last time I was in, they sent me to x-ray at the wrong time, and I missed my medicine.
Missed your medicine?
Sure. See, that's where you're wrong. They were supposed to bring it in on the hour, and they took me to x-ray 10 minutes early, so I missed my Amphagel. Oh. It's better than calcium carbonate. That's chalk, you know. And besides, it constipates me. Ampho is much more effective, particularly if I take a little fluid with it. But do you know what they're doing at night? I finally talked them into giving me Seconal instead of Nimbutol, and they never give me more than 1.5 grains of Seconal at a time. I need 3 grains to hold me. Oh, they're giving me this Milltown. I know all about these tranquilizers. They think it's all my nerves, but I know this pain is real, and I ought to be getting an analgesic.
An analgesic?
Certainly an analgesic. Instead, all they talk about is neurotic anxiety. May's terminology, as if you didn't know. Oh, I've asked my doctor to call in a consultant, but he wants me to see Dr. Antrell, state board, you know. But he doesn't understand my case. Just another head shrinker. Say, you don't talk much, do you? You're the only one who's ever still around here. The rest seem to run around all the time. Oh, can't they get anything done? Oh, nurse, I'm sure you really understand that I have a severe physiological problem. Intense pain. Last week I had a board-like abdomen. Pain on rebound. This week there's this terrible epigastric burning and gnawing. Oh, now don't try to give me a placebo. I'm too smart for that. Oh.
Seemingly severe hypochondria. Gave all the help I could. X-ray may be definitive. Long range, encourage him to accept psychiatric help.
Do something. Almost completely severed. I'll go scrub him.
Doc, can you save it?
If we're both extremely lucky.
No, Doc, no, not that! Do something!
What else, in God's name, can a nurse do?